in talking with our partners, we have two subcontractors with the Violence Against Women Act funding. One is Connecting Communities in Action out of Cattaraugus County, and they have provided the counseling to sexual assault victims. Because of the mix-up with the victim services funding, which is a whole nother funding stream, and it has nothing to do with this other than it led Cattaraugus Community Action to be able to continue the services that they are doing in Allegheny County for this year. So sexual assault victims are still going to get their funding. Our other subcontractor is in fact Allegheny County Probation Department, and they have also come up with a way to continue the services that had been funded through that Violence Against Women Act funding. We have not been fortunate enough to be able to keep the staffing that we need, so we're down a couple, like 2.5 full-time staff with other funding cuts and flat funding, and now we are at such a bare bones place that we just know it's impacting victim services. People have to have appointments. We don't always have enough advocates that are there in the office at the time to accompany people to court and to appointments with their legal and social services representatives. So it's kind of going to have a ripple effect throughout the community in terms of those services to victims and how what's happening with them impact the courts and law enforcement, et cetera. We are fairly as confident as you can be right now in this day and age, which means not a whole lot, but we have been talking to, when we realized we weren't going to get the funding, and even prior to that, we talked to Connecting Communities in Action about the impact. And we feel that for next year, another round of funding will come out, and we're going to change the way we approach this and go through Connecting Communities in Action. We feel that the application could potentially be much more viable and allow us to bring those services back into our two counties. So that is where I stand. I don't know if I forgot anything significant, Belinda, but we're here to answer any questions that you might have at this time.
You're saying you're missing significant, how much is that in dollars and cents?
Well, our DCGS contract is $50,000 a year. You want to speak to the VAWA funding?
I believe the VAWA funding, Accord's portion of the VAWA funding, I believe was $173,000 each year over 3 years. So a little over 200,000 we would be lacking. Yeah, yeah.
That was my question, so. So are you asking anything of us, or you just wanting to make us aware of this?
We specifically asked for $25,000 to get us through this year. We could combine that with some other funding and hire another full-time advocate that would help us manage the services to both the residential customers that come into our safe dwelling and also our non-residential services, which are pretty broad spectrum. We are meeting our contractual obligations through the federal and state funding that we have retained. We are doing what we need to do, but it's slower. You know, people need appointments. It's just an impact we wish the victims in our community did not have to experience. The other kind of arm of this is we have 4 people covering this entire county, and that's a lot. They're covering 24-hour hotline, they're covering the residential safe dwelling, and then they're covering day-to-day operations. So when one of them needs a day off or a vacation, it adds that additional pressure. And we are very concerned about our staff that's been doing this for a while, and we're very concerned about them, you know, their health in terms of not feeling like they can take any time off.
Leslie? Being down 2.5 positions right now, how does that impact your ability for advocacy across the county and be able to do your, you know, offer all your?
Yeah, we just can't be there for all the appointments that ordinarily, you know, we try always to be there when a victim needs us to go to court or to advocate in another situation. But with, you know, we have a manager and 3 advocates, and that's 2 advocates. And we did have 3, so that they're covering everything. So if if there's not somebody there that day, or we just can't squeeze it out, kind of they do a triage. Who needs us the most? What's the situation? What's the crisis at hand? What's the safety risk? All of those things that we would normally do. But it's just, they're just spread too thin to make us feel comfortable that we're doing everything that we can do for the victims that come to us.
Youth prevention interventions have really kind of come off the table. That was an activity funded under the Office on Violence Against Women. And we also have reduced our outreach activities somewhat. We primarily use social media as a way to reach clients who may need our services. A client experiences our services in person. There is not an opportunity in Allegheny County to do virtual court testimony unless there are extreme circumstances. So if we have a client who really has a critical case and they need some advocacy at court, if we have our other advocates serving clients writing orders, or if they have a day off, things like that, there is no one to go to court with them. So that's where we're seeing the most potential for impact. It hasn't happened yet, but we anticipate with the need for staff to maintain their own wellness and health, and for us to maintain retention, the best case scenario is to have at least 3 advocates who can cover the safe dwelling activities. That's really a full-time role in the safe dwelling when we're working one-to-one with clients, because we want to quickly get them rehoused, and that's a day-to-day activity. So all of those services seem to be reducing and compacting a little bit, which creates additional stress on our clients, creates additional stress on our staff. So, thank you.
Thank you.
I'm just going to ask Don, you have 2 contracts with Accord for domestic violence?
Yes, I do.
Do those overlap any of this?
I'm not sure how they utilize it in their organization down there. I know that the 25,000 that we have the contract for is for non-residential services, which was for the classes for victims. And then the other one is for the hotline and to help support that.
So it wouldn't address any of their issues?
Depending on how they utilize it down there, they can use some for advocacy. And they can use some for maybe like referrals or something like that.
Okay, thank you, Don.
Yep.
Does that help at all?
Yes, and we've had those contracts for years, Yes, it does help.
So it's not additional money,
Yeah.
it's money you've always
But it's
gotten.
not, it's not going to in any way impact the loss of that VAWA funding, because it's funding we are already relying upon in terms of funding those other positions and services.
So could you take that money and use it for the VAWA funding?
No,
To
because it's already being used for those they're very similar services, but it all adds, the funding streams all add into the budget that allows us to have the current staff that we have.
Thank you. Any other questions?
Madam Chair?
Yes, Mr.
Just a question for Administrator Knapp. If the committee wants to advance the request to the full board, are they going to seek an amendment to the contract, the existing contract, or would you draft a new contract?
I think the easiest thing to look at first was amending the existing contract, and if that's not possible, we would draft a new contract. We'd have that answer around by the time we have an MOE ready for Ways and Means.
Okay.
And then, of course, I'm going to ask is where would the money come from?
It's most likely contingency at this point, but we could brainstorm and see if there are any other ideas.
And you anticipate this is just for this year?
As much as we can, I have to be honest, as much as we can anticipate what that's going to look like in the next round of funding, we feel like we have a solution to how that application looked and the priorities for that, the administrative priorities set forth. We think that that is the best idea. And we have talked to the leadership at Connecting Communities, and we have agreed to this, so.
Did any other organizations get denied the money for this? Do you know?
We have not yet seen the list of awards for the current contracts. Usually it's published on the Office on Violence Against Women, DOJ website, and I have not seen that yet. I think they were giving, was it 48? I think they were giving 48 grants, and this is a nationwide grant, so it's highly competitive. And when that statute changed to direct more funding toward sexual assault services, as a lead domestic violence agency, and a continuing application, that's where we feel that we might not have been as competitive. So, and I don't know what the breakdown would be for, which states received funding or which which counties received funding in New York State, I don't know.
Thank you.
They also kind of unsegregated rural funding. There used to be a pretty significant carve-out, and Allegheny County fit really nicely in there, and now they're not doing it that way in terms of how they define and fund rural programs versus regular program or urban programming.
Right. Okay. So I guess what we're looking at is a motion to amend our contract with Accord to provide this funding, if we all agree on this?
I think right now you could just make the motion to move this forward that's in support of the funding, and then we'll write the MOE for Ways and Means on whether we can amend or whether it'll be a new contract.
Okay, all right. All right, I'll ask the board if anyone would like to make that motion, or would you like more discussion on it, and whether we want to do it or not?
Hannah will move, so we can see what we can do on that.
A second?
I'll second.
Okay. Any other discussion? All in favor?
Aye.
All right, that's carried, so it'll go to Ways and Means, and we'll see what'll happen from there.
Thank you very
Thank you for
much.
coming in.
Thank you. Appreciate your time.
All right. We are now going to go to Office of the Aging, Anita Madison. Good morning, Anita. Just so you know, we are going to be lumping a bunch of these approvals together, so we only have to do one motion and 1 second. So all the luncheon sites down to, all the lunch site, you'll just tell us each one and how much.
Okay.
And then we'll do one vote.
Perfect.
Instead of
Thank
having
you.
to go through each, just to see.
I appreciate that. Thank you.
And we'll be doing that for DSS also, I believe.
All right, so the first thing on the agenda is our monthly report. The only thing that I was going to highlight was our health insurance counseling. This month was 483 units, and the previous month was 343 units. So this is for the month of November. Our insurance counseling was a little crazy this year. For Medicare insurance counseling, our numbers continue to increase because now we are in the Medicare Advantage open enrollment, which is separate from the open enrollment that goes from October 15th through December 7th. There is another open enrollment for Medicare Advantage plans from January 1st to March 31st. So we're in a different enrollment period now. So you'll see those increase. The other thing that I wanted to highlight on the monthly report is our animatronic pets, and I'll just go grab, Tyler's going to bring it for me. Legislator Bissett had asked me to bring up the animatronic pets, thank you, Tyler, which are in our office. We purchased these to combat social isolation. This was introduced from the New York State Office for the Aging during COVID time when nobody could go and visit their loved ones at the nursing home and everyone was really isolated. So, you can bring it up, Charlie. You turned it on. So these have been a huge hit. When the State Office for the Aging contacted me during COVID and said, we want to try this, would you pilot it? I hesitantly said, sure, I'll try anything once. And to my surprise, I love that I was wrong. It was a huge hit, and we continue to purchase these. We only have a few of these left from our last purchase that Brooke came down to see. I'll turn it on, but I will turn it off so it doesn't interrupt the meeting. These are great to combat social isolation, not only for individuals, older adults who are in a nursing home or a care facility, but in home, individuals with Alzheimer's or dementia, but really anyone. And a perfect example is, and I will share this, my mom is always a test for any of our products. And she was living alone. My two brothers had passed away, and she was living alone, but I was there every day. And it came out with this, and I said, I want you to try it. And she said, well, you're here every day. The grandkids are here every day. How could I be lonely? I said, I don't know. I just need to have you try it and tell me your thoughts, because you, out of everyone, will tell me exactly what you think. And she did, and she called me and said, I love it. I know you're here, but at night, it recognizes when I get up to go to the bathroom, and it wakes up, and I don't feel alone at night. So even though you offer support to your loved ones, there are always downtimes where they just need a little bit of comfort. Charlie, this is Charlie's dog now. It really is. So we have dogs, we have cats, and the bird is a walker squawker. It actually is an evidence-based falls prevention method. I'm just going to pass this around. So the falls prevention, part of that is the walker squawkers attached to a walker, and it reminds older adults when they get up to take their walker with them. The more that they walk with the bird, the more songs that are released, and so you can get new songs the more that you use your walker. So it is kind of like an alarm, if you will, but a nice alarm for individuals to remember to take their walker with them. Do you want to add anything?
Well, I was unaware of this program that we had, so we actually bought one of these cats from my mother over Christmas, so she has a companion at home, which it also helps her a lot during the middle of the night or morning when she gets up. She actually has she hears sound, there's noise there. Since, we're not there every minute of the day for her, she actually has a little companion there. So, they seemed a little weird to me, but it's it does help. It's like I said, it creates just a little noise and just companionship. There you go. It purrs, it does meows. My dog loves it too. So the biggest thing is making sure everybody in the community knows about these offerings. So if they do have a loved one at home that's by themselves, it does help, just that little bit. So thank you, Anita.
You're welcome. So far, since COVID, we've given out over 170 of these animals to our community members. We can turn the cat off now. Oh, sorry. And this is highlighted on our monthly report as well. We do share how many we give out. Hold the button on its tail for the bird. Thank you. Is there any questions on the monthly report or any of the animals? That was an impromptu, but it was at the request of Legislator Bissett.
Okay, thank you.
You're welcome.
All right, now we will move on to the luncheon site agreements. We
Okay.
have, I believe, 1, 2, 3, 4, 5, 6. We have 8
Yes.
sites to approve.
Correct.
So Anita's going to read us where the site is and how much, and then we will make a motion and approve all 8 of those at the same time.
Okay, so the first one that we are asking permission to enter into is an agreement with the Union University Church, which is at 29 North Main in Alfred. This is for our Alfred Luncheon Site. This is for the term of January 1st, 2026 to December 31st, 2026 at the cost of $17.50 per day per use. And this contract has been, the terms and conditions have been reviewed and approved by the County Attorney's Office. And it is in our 2026 budget. The total for all of our congregate locations is $13,062. That is budgeted underneath that account number. That's the first one. Do you want me to take questions individually or at the end? Okay. The next one that we're asking permission to enter into is an agreement with Herbert DeLong for the Belmont Luncheon Center. Same terms, January 1st to December 31st of 2026. There is no cost for this location. The next contract that we're asking to enter into is for the Richburg Fireman and Auxiliary Clubhouse. This is our Bolivar Richburg site. Same terms. This site is a $12 per day. Next site that we're asking to enter into an agreement with is the Canasarega Fire Company, which is our Canasarega Luncheon Site. There is no charge for this facility. The next one is for the Cuba Fire Department. We're asking to enter into an agreement with them for our Cuba Luncheon Site. Same terms, January through December, and the cost for that location is $16 per day. The next contract that we're asking to enter into is the William Brooks Hose Company, which is in Fillmore. That is for our Fillmore Luncheon Site, and that is for $11 per day. The next one is for the Grace United Church in Wellsville. This is for our Wellsville Luncheon Site location. This is for $12 per day. And the next one and last one is for the Board of Fire Commissioners of Independence Fire, which is the Whitesville Luncheon Site. And the cost for that is $13 per day.
Friendship doesn't do it any longer, or?
We don't have a Friendship site right now. No, we only have 8 luncheon sites currently.
Okay, all right. I'll move.
Second?
I'll second.
Any other questions? All in favor?
Aye.
Thank you, and that's carried. Then we will go to the home and health care service contracts, and we
Okay.
will do those 4 together.
Those 4, okay. So the first one that is on the agenda is for Elderwood. We're looking to enter into an agreement with Elderwood at Hornell for a 1-year contract from January 1st to December 31st of 2026. This is for respite services for temporary placement through caregivers, Alzheimer's, which is Alzheimer's Caregiver Support Initiative, or ADCSI, also for ISEP, which is another funding stream. All of the account numbers are below. The cost for this would be for a 24-hour stay in a private room at $490 and for a semi-private room at $453. The next one is for a respite contract we're asking to enter into with Houghton Rehab and Nursing. This is for the same term, January 1st, 2026 to December 31st, 2026. The rate for this would be a 24-hour stay at $490 for a private room and $480 for a semi-private room. The next contract we're asking to enter into is a contract with Jan and Bev's Home Care Services. This is to provide in-home care through our ISEP, Alzheimer's, or ADCSI Unmet Needs and 3E grants for the term of January 1st to December 31st. And this is at a rate of $33 per hour. This is an increase of $1 per hour from our 2025 rate. And the last, nope, 2 more. This one is for Will Care. We're asking to enter into an agreement for Will Care Home Care Services using ISEP, 3E, Unmet Needs, and the EDCSI grants. Cost for this would be $31 for PC Level 1, which is a housekeeper chore level, $32 per hour for personal care, and $175 per visit for an RN supervisory visit. And that rate is the same as 2025. They did not ask for a rate increase.
Okay.
Okay, so the next one on the agenda is for AIM Independent Living Center. We are asking to enter into a contract with AIM Independent Living Center for consumer-directed home care aids using ISEP 3E, which is Caregivers, Unmet Needs, and ADCSI, for the term of January 1st, 2026 to December 31st, 2026. The cost for aid service through this agency would be $29.50. This is a rate increase of $1.50 per hour from the 2025 rate.
Can I have a motion to approve that?
Hanchett will move.
Karen, second.
Any questions? All in favor?
Aye.
And that's carried.
Next on our agenda, do you want me to keep
Yeah,
going?
I
Okay.
just want to make a comment. This isn't working. I can't see the people behind me if they have any questions. Just so you know. Okay, go ahead.
Okay. Okay, so the next item on our agenda is for Highland Park Daycare. This is for a respite contract. We are looking to enter into this agreement to provide respite services at Highland Park Adult Day. The cost for this would be at $104 per day without transportation. $52 for transportation two ways, or $28.08 for transportation one way if that needed to be included. There is no rate increase from our 2025 contract. This is the same rates as 2025. And this is to provide respite services at a medical day program.
Can we have a motion?
Whitney, a motion.
Second? Any questions? All in favor? Aye. And that's carried.
Next on the agenda is for Home and Health Services. We are asking permission to enter into a contract with Home and Health Services to provide in-home care services through the ISEP ADCSI Unmet Needs in 3E or Caregiver Grants for the term of January 1st to December 31st. The cost for this service would be $32 per hour and $130 for a nursing supervisory visit. This is an increase of $1.50 per hour for home care services from our 2025 contract, and no rate increase for the nursing supervisory.
We have a motion for that.
Hanchett will second.
Any questions? And just so everyone's aware, if you look at each of these under fiscal impact, Anita has said how they are in the 2026 budget. So if anybody had a question about that. Okay,
Thank you.
and the next one.
Okay. Next, we are asking to enter into an agreement with Total Senior Care Daybreak Program, which is a social adult respite program. This is for January 1st, 2026 through December 31st, 2026. This would include the socialization, supervision, monitoring, and minimal personal care. The cost for this is $75 for a full day of respite service, $50 for a half day, which is 3 hours or less. There is an addition to this, which would be at a $30 per shower fee that is not included in the rates set above. This is an increase of $15 per full day and $10 per half day from our 2025 contract.
We have a motion?
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And that's carried. And one more, Anita.
One more. We are asking to enter into an agreement with TC's Diner, an amendment to the agreement with TC's Diner from our 2025 contract, original contract, which is resolution number 47-25. In the original agreement, it was from January 1st, 2025 to December 31st, 2025. We are asking for an amendment to extend the terms of that contract to end January 31st, 2026, so just 1 month into 2026. This is for our Go and Dine program, and this would allow individuals to use vouchers, continue to use vouchers in the month of January at this location. TC's Diner is not going to renew a full contract with us for Go and Dine because they are selling the business. So we are just looking for a 1-month extension from our original contract to finish it out.
We have a motion for that. Second?
Hanchett will second.
Any questions? All in favor? Aye. And that's carried.
That's everything.
Thank you, Anita.
Thank you very much.
All right, we will now go on with Public Health Director Tyler Shaw. Thanks for bringing those. Welcome, Tyler.
Good afternoon. Just a
Morning.
quick highlight. Oh, yeah, morning. Yeah, thank you.
We're used to afternoon.
Changed it up. Just a highlight on my monthly report. We're still finalizing some of our numbers for 2025. We're typically a month behind on those, but just some highlights in the clinical patient services. That's that first page there. Our cases managed under lead, we were up this year. Last year, around this time for the year, was 27 total. We're managing 35 cases. Tests reviewed were up from 849 to 853. And on the discharge side, we're actually doing well. Last year, we discharged 13 total, and this year we discharged 20 total. And then on our STI investigations, we are down. Last year we had 203, we're down to 171. But I just wanted to give you a general sense in the patient services side on general communicable disease. This year alone, we reviewed 5,617 labs that came across our office.
With how many staff?
That's one nurse.
Good job.
Any questions on the monthly report?
All right. We'll go on to your agreements.
Okay. First up is an agreement with Accurate Analytical Testing, and this is for our lead program. And it's to test lead in drinking water, wipes, paint, and soil samples. You'll see on the fiscal impact, there was no increase from the previous contract last year.
We have a motion to approve that.
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried.
Next is an extension of our billing services agreement. If you remember last year, our clinic secretary had retired, and we were in the process of training her. Our current staff member is going off on maternity leave, so we do need to extend that contract.
We have a motion for that. Any questions? All in favor?
Aye.
And that's carried. Thank you.
Next up is our Child Lead Poisoning Prevention Program grant agreement. This is a renewal of a state grant contract in the amount of $49,900 per year.
We have a motion for that.
Hanchett will second.
Any questions? All in favor?
Aye.
Carried.
Next is another renewal of a state aid grant contract, and it's for our Comprehensive Family Planning Program grant, and it's in the amount of $324,324.
Hanchett will move.
Second. Any questions? All in favor?
Aye.
And that's carried.
Next is a preschool related and evaluation services provider agreement with Full Scope Speech Language Pathology, and they're out of Bolivar.
Can we have a motion for that? And a second? Any questions? All in favor?
Aye.
And that's carried.
Last but not least, I have a request to fill. So your form says request to create and fill, and so does the agenda. It's not a create and fill. This is an existing position. I do apologize. That was my fault. It is a request to fill our earlier intervention service coordinator. And this is a part-time position, and it is in the budget.
All right, can we have a motion for that?
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And that's carried. Anything else to say, Tyler?
That's
All
all.
right, thank you very much.
Thank you.
You can tell it's the beginning of the year because we have all these contracts that we have to approve. All right, now we welcome Don Horan, Commissioner of Social Services. Welcome, Don. And Don has a lot for us to approve as well, and he's also going to give us an update.
Good morning.
Good morning.
Just real quick on the monthly report. We are taking applications for daycare. We still have funding for that. So we'll expect to see that number go up a little bit. Code Blue is in full swing with the cold snap. So we're housing people in hotels and motels. And down at the very bottom on the first page under Adult Protective Services, representative payees, we will start to see an increase in that. We're starting to get a lot of guardianship cases that we're becoming guardian for now due to the lack of people not being in state or having nobody to take care of them or their finances. Any other questions on the monthly report?
All right, and you want to give us an update on the federal funding?
Yep. As you know or may not know, the Health and Human Services is directed by the current federal administration to put a freeze on 3 funding streams that we use to fund our programs, one being TANF, one being the Social Services Block Grant, or also known as Title 20, and the other one being daycare. I have not gotten any direction out of New York State oversight agencies, OCFS, or Office of Temporary Disability Assistance. The last I knew, for the 5 states that were affected, the Attorney Generals for those 5 states filed an injunction on January 8th that was granted on the 9th for a 14-day stay. I'm waiting to see what's going to happen. That should expire on Friday, the 23rd of this week. So.
Does anybody have any questions about that for Don?
I do.
Gretchen?
So I know that it's going to impact, what impacts do you see in the services that you'll be able to deliver?
TANF and Social Services Block Grant are mandated services, so I'm not sure how the state would handle that or the federal government would handle that. They're mandated by the federal government, so I can't picture them just saying, oh, we're not going to fund this anymore. I mean, you mandated it.
Right.
So it'll be interesting to see what happens with that. Daycare, we know what I did with that last year. I can limit that. So if we see that funding, we can put the brakes on there to make sure that we don't include any more local share with that.
Any other questions? All right, we'll move on then. We are going to block number the first two nurses.
Yep. Child Advocacy Center, these are renewal for contracts. All these are in the 2026 budget, and they all are funded. The first one is for Brandis Gaylor. She is a sexual abuse nurse examiner. Cheryl Wire is also a sexual abuse nurse examiner. They are the ones that children see when they come into the Child Advocacy Center.
Can we have- Sorry. Go ahead.
I'm sorry.
Go
Let
ahead.
me keep going.
Yep. Those two we're going to block, so we can vote on those together. So can we have a motion to approve those two?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. Okay, now we can go, these we'll do
The next
individually.
three?
Yeah.
Okay. The next one is for Dr. Coyne. He's the medical oversight examiner for the Child Advocacy Center. He's the one that directs Brandis and Cheryl. And Olean General Hospital, they're the ones that we purchase the supplies for in the exams. And then Cattaraugus County Rehabilitation Center, they perform the maintenance on the office in Olean.
We have a
Hanchett will
motion?
move.
We have a second? I'll second it. All in favor?
Aye.
And those are carried. All right, so we basically approved the last three, right? Is that okay, Tiffany?
The next one is for our child support unit. When the magistrate orders for DNA testing, we use Laboratory Corporations of American Holdings. They charge us $50 a test, and that is also in the 2026 budget.
We have a motion?
No motion.
Second?
Second.
All in favor?
Aye.
And that's carried. And then the next two we will block together.
Okay, these next two are paid through Medicaid. We do not receive the bills at the local level. They support our Consumer-Directed Personal Assistance Program. That program is very helpful for those who qualify for it. So we are not putting elderly people in the nursing home so they can reside at home with home aides.
And we'll, both of them say, okay.
Yeah.
Can we have a motion for those two?
Hanchett will move.
Any questions? All in favor?
Aye.
And those are carried. And now we go down to the preventative programs, and the first two we will block together.
Okay. We have two contracts with the Parent Education Program. They're both preventive services contract. They are both budgeted in 2026. Families Together is budgeted for $160,720. Families First is budgeted for $96,985. They both receive reimbursement.
Okay, can we have a motion?
Hanchett will move.
Second?
Karen, second.
Any questions? All in favor?
Aye.
And that's carried. Okay, and then we do the next two individually.
Okay. Individually, okay.
Yeah.
The next one is Catholic Charities. This is for our SHAPE contract. This is a preventative contract, and this provides support for families and supervised visits. This is budgeted for $304,548.
We have a motion?
Karen?
Second? Any questions? All in favor? And those are carried. That's carried. Okay. And then
Okay.
Hillside?
Hillside Children's Center in-home parenting services is an intensive service to make our kids that come into care, and they work with their parents to get better parenting skills so children can return to home. That is budgeted for $123,600.
We have a motion?
Karen?
Second?
Hanchett.
Any questions? All in favor? And
Aye.
that's carried. And then the next two we can block together.
Okay. The first contract with Ready is for foster care transition. That is to move children out of foster care and get them back in the home, or work with potential kids that could come into foster care so they don't come into foster care. That's $115,000. And then Ready Community-Based Mentoring Contract is mentoring services for children who struggle with social skills or may be struggling in school or struggling in the home, and that is budgeted for $277,500.
We have a motion to approve those two.
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And those are carried. And then one more in that
Yep.
category.
Together for Youth, this is our youth turnabout program. I like to call it the after-school program. We have a mentor in Genesee Valley and Bolivar Richburg, and they work with children in middle school we identify them by their grades or maybe by their attendance or something to improve on that, and it's a very successful program. That is budgeted for $233,741.
Okay, can we have a motion for that? Second? Any questions? All in favor?
Aye.
And that's carried. The next four we can block together.
The first one is for Allegheny County Community Services. This is for qualified residential treatment or a qualified individual to do QI assessments on any kids that come into care. The next one is Catholic Charities for the same service. Hillside Children's, same service as the first, and Together for Youth is the same service as the first. We are very limited on time when a child comes into care under the Families First Prevention Services Act. So we need to have multiple people that we can have do these assessments. And then if the children are placed, we need that assessment to occur in 30 days or we could lose 4E funding.
We have a motion.
Hanchett,
Second,
Okay,
first?
yeah.
and we have a second, right?
Yes.
Okay. Any questions? All in favor?
Aye.
And those are carried. All right, now we have two more.
Yep. The first one is for Dr. Scott Anderson. He does our forensic interviews for evaluating families and children that come into care. And Dr. Craig Zuckerman does mental health consultations and evaluations also. We use these reports and we use them part of the corrective action plan that is submitted to family court.
Okay, can we have a motion to approve the first one?
Hanchett will move.
Second?
Second.
Any questions? All in favor?
Aye.
And then a motion to approve the one with Dr. Craig Zuckerman.
Hanchett will second.
Any questions? All in favor?
Aye.
All right, and then we have a few more. Hold on.
Would you like me to block all those together?
We're
or-
going to do the first one, and then we're going to block the next two.
Okay. The first one is for Allegheny County Council on Alcoholism and Substance Abuse. We are mandated when people come in and apply for assistance to do drug and alcohol evaluations on them, and we contract with them, and we have a part-time employee that is located here that is budgeted for $75,551.
Motion? Second? Any questions? All in favor?
Aye.
Carried. And then the next two we can block.
Yep. The next two are for domestic violence services with Accord. They were the ones that I spoke about earlier. The first one is for the hotline and referrals and advocacy, and the second one is a class for victims of domestic violence for coping services.
We have a motion?
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And that's carried. The next two we'll do separate.
Okay. Legal assistance, a Western New York contract. This is a mandated service. We have to have attorneys on standby that we can offer to our clients that come in, or maybe refer them out when they're having problems with landlords, et cetera. And that's budgeted for a max of $10,000 a year.
Motion?
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And that's carried.
The next one is with Southern Tier Traveling Teacher. This is for employment and educational services. They go out and work in the home, and they help persons either with job plans, or if they don't have a degree or a high school degree, help them get through their GED.
Can we have a motion? Second? And any questions? All in favor?
Aye.
And that's carried. We're getting there.
Yep. Two more of these. This one, the next two though, are not budgeted in 2026. So I'm looking for permission to accept the grant, appropriate the grant, and disperse the grant. They kind of did this backwards. They changed it up at the state. We usually do the resource allocation plan first and then get an approval for that. Now they have us do all the requests for people who want to join into the grant, and then we have to input that into the system, so they don't do the resource allocation plan anymore. We did increase the grants for both youth sports education, and youth developmental fund by $21,222 from last year to this year, and we picked up 3 new programs.
Okay, can we have a motion to approve this? Any questions? This will be all funded through a grant though, right?
Yes.
Yeah, okay. All right, all in favor?
Aye.
And that's carried.
2 more.
Yep. Okay, just clear, we just approved both of the youth ones. Is that okay to do those together? Okay, okay, so just want to make sure we all understand what you just approved. Okay, go ahead.
The next is permission to apply for the Office of Victim Services Grant. This is the big grant that helps mostly support the Child Advocacy Center. We did apply for this last year. We were successful in getting a large sum of money, but that was rescinded by New York State. So they just continued the grant that we had right now. So we will be applying for a little bit more than what we applied when we received the large sum of money.
We have a motion?
Hanchett will move.
Second? Any questions? All in favor?
Aye.
I just have a quick question on the Child Advocacy Center. Cat County, are they contributing as much as Allegheny County? And because it appears that they have more people they're serving than from Allegheny County.
Right now, they are not contributing to it. We're supporting the majority of it with all the grants. I do have a meeting set with the new commissioner in Cattaraugus County to speak about this, just because of the funding for this year, the way it went, so.
Great,
So I'll be working on that.
thank you.
Okay.
Okay, request to fill.
Yep. Last but not least is request to fill a senior typist. This is due to a resignation.
All right, can we have a motion to approve that? Second? Any questions? All in favor?
Aye.
And that's carried. I think we're done.
That's it.
Thank you, Don.
Thank you.
And good luck with the freezes. Now we welcome Dr. Anderson, and it looks like Lindy's here also, Director of Community Mental Health Services. Sure, I think we're going to table this, okay? What? We're going to table this. Okay.
Going to table this?
Yes, I believe we are.
So I made the long walk up
Yeah.
here for nothing. She just wanted to see if I was still mobile. So we'll table
Yeah, we're gonna-
everything on the
Yes,
agenda.
yes, we're going to table it just to clarify some of the budgeting of it, and we want to make sure that that's straightened out before we go ahead and approve it.
Thank you.
Thank you.
Appreciate it.
All right. All right, and then we have one more thing we have to do, and that's an agreement with Allegheny County Association for the Blind and Visually Handicapped. Can we have a motion to approve that? All in favor?
Aye.
Any questions? And that's carried. Any unfinished business today? Any new business? Good to the order? And I will take a motion for adjournment. Second, all in favor?